the home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.
Hello. It's so good to have you join me again for another show. How have you been? What have you been doing? And what good news can you tell me? As you know, Healthcare Hour with me, Colleen Qvist, is all about healthcare professionals. It's about us understanding that they are human, they get tired, they get hungry. And of course, that's been in the news quite a lot about them being tired. And also, it's about us improving the relationship between the healthcare professional and the patient, and the healthcare professional and the patient's family. And also, it's for us as the public to be educated, for us to understand what's happening, and not to be just ostriches with their heads in the sand. And some people will tell me that ostriches don't do that. But yes, we know the expression of hiding away from the truth. More about VUCA Online Radio. It is your inspiration radio station. We like to do things differently. We like to be inspirational. We like to inspire people to take action, as opposed to just running around finding faults and being negative about things. It's also, I'm a coach. So I'm a coach with a healthcare radio slot. And it's also important then that we look to see, how do we grow? How do we allow people to reach their goals, as opposed to just criticize. When we come back, we're going to be looking at headlines in healthcare, of course, from a South African perspective, and then also a bit out of the country, a bit, globally. But of course, depending on where you are joining me from, you are probably going to be thinking, no, those aren't the headlines, because the front page of your newspaper, assuming you have newspapers still, or the front page of your news headline may be something different. So do share with me what your headlines are. But let's go for that break.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.
Welcome back. You are listening to Healthcare Hour with Colleen Qvist. And today, I thought we'd have a different show. I thought let's look at headlines in healthcare, and also for me to just talk to you, not to have a guest, for me to just share some of myself. So recently, I have come back from a holiday or vacation, depending on where you're living. And it was quite interesting this time, where I put my out of office on. I normally put my out of office on, but then I go away and I would normally log on into my laptop every single day and read and action my emails. And this time I did it differently. I put my out of office on and I only logged in once in 7 days and read and action my emails on those days. And it was quite liberating, quite freeing to go like, I'll cope with it when I get back. And of course, that's what I did. I did come back and I coped with all the emails and all the things that were there, but just not that 24/7 on duty, on call, hang on, what's going on here? Yes. And it does help as well in that some of my emails from a different email address I don't get on my cell phone or on my mobile. And so it was quite interesting there wasn't that pressure of, oh, but I wonder what. And it was almost like I was saying this time around, no, I will not be logging on. And so I didn't. What I also did this holiday is to spend time reading Gabor Mate's When the Body Says No, The Cost of Hidden Stress. And for me, it's quite interesting in that, yes, prolonged stress leads to disease. And I think what's happening is that healthcare is admitting to or starting to understand that, yes, prolonged stress does lead to disease. And what is it that we're doing about it? Because when we keep on treating disease, when we keep on treating the symptoms, we're not getting to the cause. And so what was interesting as well there is just what Gabor was saying is, I wonder if you pronounce his name like that. Somebody will tell me. But 3 factors that universally lead to stress are uncertainty, the lack of information, and the loss of control. And what was also fascinating for me in reading that is that sometimes we are aware of our stress. We're aware of, oh, gee whiz, that took it out of me. Maybe you are getting divorced or you moved house or those, like things that really hit you. But what we also got to understand and look out for is the stress that we aren't aware of, the stress that's there, the acute stress. The acute stress we know about. It's that chronic stress that's just there the whole time. And it becomes our normal. And I think in our working world, we understand that the stress has almost become normal. It's become, oh, well, the adrenaline pumps, the cortisol levels are off the charts, and that's our normal, which is quite sad. Okay, so back to headlines. Yes, now that I'm back, now that I'm refreshed and raring to go again. Something then in a South African setting that has been part of our headlines is the very sad passing away of an intern. He worked in KZN. He was only 25, and his name we would like to share with you. His name, Dr. Aluluto Mazwi, 25-year-old young man, and we would like to extend our condolences and our heartfelt grief with his family and loved ones. And what happened with this young doctor is that he was not feeling well, and he was ordered to go to work and to continue working, and he ended up passing away on duty. He was diabetic, and we don't know exactly what happened yet. We're waiting to hear because, of course, there has now been an investigation. And the things that we're looking at is what happens is that when something hits the public space, it becomes quite, oh, we didn't know that. Oh, okay. And it's a very well-known fact that medical doctors work ridiculous hours for numbers of reasons. Okay, first of all, it's the system. It's the way we do things. Secondly, because there's a shortage of doctors. And so it's quite strange to get to the end of your shift and then say, okay, well, I'm done now, and walk out the door. If there's no doctor to relieve you, you can't just walk out the door. It's also important as well that our doctors provide 24-hour care in our government institutions. And so in order for there to be 24 hours, what HPCSA, Health Professionals Council of South Africa, is saying that each doctor should be working 40 hours a week, and there is a maximum allowed of 20 hours. So that's 60 hours in total. But what's happening is that many doctors are working between 80 and 120 hours a week. Now do your maths. Whether you divide by 7, you divide by 6, you divide by 5, you get a scary number of hours of working. And it's ironic, really, when you think that the healthcare profession of all places knows the impact on people when there's lack of sleep. They know the impact from prolonged stress. And yet they are now looking after other people. And what you also see from an ethical point of view is we start off saying, okay, I've worked my 80 hours now, I'm going to walk out the door. Or actually, I've worked my 60 allowed hours and I can walk out the door. But what about the patients who are left there? I can't just walk out. And so ultimately, the patient's rights, then they supersede the right of the doctor, because you can't just leave sick patients. But ultimately, if you've got a doctor who's worked 80 plus hours, is it really in the interests of the patient? But is a doctor who's worked 80 hours better than a doctor who's worked, who isn't there at all? And so that's all, all the things that go into this. And of course, what's happened now is the MEC for Health in KZN has said that her door's open. Please come and tell her. Please, lodge grievances if you aren't being treated properly and in the hospital. And, write an anonymous letter, do all those kind of things. And you probably find, I'd be very interested to know how many letters she's had, anonymous or otherwise. But it's very difficult to fight something where it's the system. It's the way things work. It's the way it's been done. And not only when we stand up and say, no, the system must change, you'll find that people who've come through the system, who have survived the system by hook or by crook, are very reluctant to say, oh, but I did it. I survived. Come on, what's wrong with you? You people are just weak, kind of story. And so it just continues. It's almost like that whole boarding school story where you have people who, with the bullying at boarding school and all the different, rituals and, all those kind of things. It's almost like it doesn't go away because the people who've gone through it then become worse than the ones that, how they went through. Yeah, so lots of things to look at, but certainly how the system works, the fact that we are offering 24/7 care, and also that there is there are a shortage of doctors. The ethics of walking out when you can't, well, my shift's finished now, when there's no one to hand over to. And yeah, so there's so many different factors. And what I would like to see this time is let's actually change systems. Let's not just talk about it, because I don't know if you've noticed, public, but it's very much in the public eye for a little bit, and then it all fades and goes away. And everyone thinks, oh, but okay, it's fixed now. No, those doctors are still working their 80-hour plus shifts. It doesn't go away in their lives. It only goes away in our life, where it's not front and center on the front page of a newspaper anymore. So that's the whole story with the intern, where so many factors, feeling ill, was told that he had to come to work, was told that he had to work his shift. Yeah, so I mean, there's so many factors where you think, okay, he knew he felt sick. Could he have stayed at home? But in a system that doesn't allow you to stay at home, in a system that allows you to see your responsibility is to the patient, your responsibility is to drag yourself out of bed and go and serve the patient, there isn't really just, it's easy for us to say, oh, but he felt sick, he should have just stayed at home. In a system that works on fear, and in a system that works on ethics to patients, it isn't always just possible to just do something. I would also like to extend my thoughts to the senior manager, to the supervisor who has been suspended, because it's very easy for us to turn around and now blame the supervisor and say, oh, the supervisor's bad. But it's also the supervisors working in a system, and the supervisors working in a system that they've probably come through. Yeah, so it's quite easy to find the scapegoat now. So on that, let's go for a break.
The Africa Center for Web-Based Learning is a professional development center for professionals who aim to improve their professional standing. This means that the learning programs we run are more than just academic programs. They are work-based programs that focus on leveraging your current experience as a professional to build your overall profile. A year down the line, the Africa Center for Work-Based Learning is developing into a preferred center for professional development in Pretoria, with 8 professional development faculties including accounting, teaching, entrepreneurship, as well as IT and many more. For more information, go to acwbl.org or dial +27 12 751 7608. The Africa Center for Work-Based Learning, where work is learning.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. Today I decided to just have a chat to you myself, and I thought let's not have a guest today. I would chat to you about different headlines in healthcare. Of course, depending on where you are, you're going to have different headlines, and I'd love to hear what your headlines are. Another headline in a South African setting that has been very much front and center in the news is this idea of overtime, paid overtime. So as you know from already, we're looking at the 40 to 60 hours that a junior doctor is allowed to work, 40 hours of normal and 20 hours of overtime. But of course, they're working 60 to 80 hours, if not more than that. And what is that? Or actually even 80 to 120 hours. What has happened as well is that in terms of being paid overtime, what in the Eastern Cape, overtime suddenly just got stopped. And the doctors in the Eastern Cape have refused to work extra hours without compensation. So it's bad enough having to do the extra hours without now you're not going to be paid. And what they've also said as well is that this has now led to staff shortages in the hospitals. I think there are staff shortages in the first place. And the Provincial Health Department has acknowledged that they don't have the budget to pay overtime. So we just don't pay overtime. And of course, you then have repercussions. Yes. But doctors are saying, gone are the days now of, but you're a doctor and ethically you need to work. No, they need to be paid for the work that they're doing. What you're also finding as well is this whole paid, not paid story and not being paid overtime has also reared its ugly head in Gauteng, which is one of our provinces in South Africa. And what has happened is the Gauteng Department of Health has proposed to reduce overtime contracts. And what has happened is that medical professions and unions have met this little announcement with outcry. And they said that, if you're going to cut overtime, you're also going to exacerbate existing staff shortages and compromise patient care. It's funny how when you knock dominoes over, dominoes all impact the next one. They're all lined up. This one knocks that one over, knocks this one over, knocks that one over. And it's always surprising when somebody moves one domino and doesn't understand that they impact all of them. Yes. And I'm sure that you won't be surprised to understand that all this, all these overtime, all these lack of self-care, and it's all very well saying to doctors, but it's in your pledge to self-care. But where are they supposed to self-care if they're working so many hours? Where are they supposed to self-care when it's ethically you need to look after the patient, but they're not featuring any? And so what you're also seeing is that there's increased mental health challenges, with the overwhelming workloads, with inadequate support, infrastructure is not what it should be in government hospitals. So there's lots and lots of factors that all just topple together. It's a whole bunch of dominoes that just all one leads on the other, and the next second they've all fallen over. What we're also seeing as well is, there still is the stigma and discrimination when a healthcare professional says that they need help. Of course, until we have suicide. When somebody's died by suicide, then there's that outcry again. Then there's, oh, but the person should have got help. Oh, but this should have happened. Oh, but that should have happened. But, why is there no support so that it doesn't happen? There have been a lot of suicides. We don't have the suicide rate, gratefully, For instance, America has 400 physicians a year who die by suicide. Ours is less than that. But you know what? Even one is tragic. Even one is too many. So yes, what we're also seeing as well is that there aren't necessarily the resources available, or if there are resources, the healthcare professional doesn't feel like they're able to take up those resources without there being discrimination. So yes, that is what is happening over there. What you're also seeing as well is that we are being impacted. So moving on to another headline, we're being impacted from a point of view of how HIV support has been withdrawn. What is happening is that it's now affecting from an HIV position and also from a TB position. We've also said, you know, a lot of services are run in South Africa where we have prevention services. We also have antiretrovirals where you go and get your ARVs. And what has happened is the reduction of US aid has significantly affected HIV and TB prevention services, leading to the closure of key clinics and disruption of services, particularly in provinces like Gauteng, Western Cape, Northwest. And community-based programs and services for vulnerable groups have also been compromised. And based on that, what you're finding is that there has been an increased health budget because of these cuts. And so in response to the US aid, South Africa has allocated an additional 28.9 billion, so nearly 29 billion rand, to the health sector to address the needs of its large HIV positive population. What they've also been doing in government hospitals is also looking for the people who are HIV positive but don't go for treatment. So they've also been trying to reach out to those people. Yes, and so what they're also trying to do is include hiring medical personnel and procuring extra equipment. What you'll also see, not necessarily recently, but a while back, is that the National Health Council has approved the advertising of 1,200 doctor positions. Remember, I did a program a while back about the fact that 1,800 doctors didn't have positions. They weren't employed. They were unemployed. So now 1,200 doctor positions have been unfrozen, as well as 200 nurses and 250 other healthcare roles, with the idea of alleviating the stress in the healthcare system. It would be interesting to hear how far that is. Have you been employed? Are you one of those 1,200? I know that the Nursing Council did complain and say that they needed far more than the 200 positions. So has that had a difference? Or are we all just in the planning stage? Are we all just in the advertising stage and people haven't been employed yet? Yes. Then what has also been in the news is the NHI, National Health Insurance. And this is where so many organizations across South Africa have complained about it being unconstitutional. Now, please understand that we all agree that everybody should have an equal access. We should have universal healthcare. Yes, we all believe in that. But the NHI is something that is not possible, according to many people. And so the South African Medical Association has launched a comprehensive constitutional challenge against NHI, citing concerns over access to care, administrative barriers, and the impact on both doctors and patients. And what you'll see recently in the news is that the Board for Healthcare Funders, which is the medical aid schemes, have actually taken NHI to court, and they're saying that it's unconstitutional. And they were just had a win recently about it being unconstitutional. So yes, on that note, let's go for another break.
How do you know the life or personal coach you're about to work with is who they say they are? How do you know if they can do the job? At the Africa Board for Coaching, Consulting and Coaching Psychology, we can tell you. So, before you share your secrets and spend your money, check with us first. Visit www.abccccp.com or call us on 012-751-7608. The ABCCP, the professional body for coaches.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. Today we're looking at headlines, specifically in healthcare. Of course, we're looking at them in a South African context, but also across the world. What else is happening? So, as you know, AI has become quite in the news. Everyone's talking about AI now. I think sometimes people talk about AI without knowing what it is, but they talk about it anyway. What has happened is the World Health Organization has established an AI governance center, and there what they're saying is that they need to ensure responsible and equitable use of AI in health systems. So this AI governance center has been established in the Netherlands Digital Ethics Center at Delft, University of Technology, and it's a collaborating center on AI for health governance. So that's also good to know. What you're finding as well is that sometimes technology outpaces ethics. Technology outpaces the rules. And so it's almost like, but we can do it in technology. Okay, but should we be doing it? How should we be doing it? Who does this impact? Also, yay, look at all the data we have. But who did the data come from? Does it represent everybody? Is it skewed to a specific population? So there's so many different factors in that. Also on, all things internet, what's happening is that there's now big cybersecurity threats. And when you think about it, people now have all kinds of gadgets, like whether it's your phone or it's your, even my dad recently got a hearing aid, and his hearing aid volume and how it operates is all linked to his cell phone. Yes. So what's happening there is that we're having cybersecurity threats to all different kinds of equipment. And what we're now trying to see is that how is this going to compromise patient data and safety? It's pointless if there's now a virus in your cell phone or there's a virus in your laptop, and this is now impacting your device, whether it's your pacemaker or your hearing aid or, of course, all other kinds of equipment. Yeah. And then what's also happening is that there is just some of the other headlines. There's a malaria outbreak in the DRC. The Democratic Republic of Congo is experiencing a malaria outbreak in Equateur province with nearly 1,100 confirmed cases and over 60 deaths. It's concentrated in remote areas and it's complicating containment efforts. How do they get to stop it? How do they get to contain it? Because it's in such a remote area, it's becoming quite difficult. Yes, and then also something that's quite interesting is climate change threatens blood supply. A study published in the Lancet Planetary Health highlights how extreme weather events driven by climate change are disrupting global blood supplies, posing risks to patients requiring transfusions. So you can see, back to my dominoes, how one thing impacts the next. And we work in systems, we live in systems. And it's also understanding that when we topple one little domino, it's going to affect something down the line. What you may also have seen on one of my posts, I've said that often we choose to do something today without working through, but if we do this, what is it going to happen down the line? And so we take responsibility for domino 1 or domino 2, but we don't take responsible for domino 613. But it all starts from us toppling over that first one, which topples over the second one. And zoom, down the line, it topples over the 600th one. So it's just something that we need to be aware of, in that when we work, when we're all part of each other, when we're all integrated, when we're all part of that system, one part, stress in one part impacts the other part. So let me ask you, what's happening in your headlines? Have you noticed? Have you seen? Does it impact you? Do you feel anxious about what the headlines are? I'd love to hear from you about that. Also, what kind of shows would you like? Would you like us to dig in deeper into any of these and have specific expert guests on these different topics? What is of interest of you? What do you want to know more? And if you are South African listening to me from America or Russia or anywhere else in Africa or Europe, please let me know what your headlines are and what you would like a special show on. Thank you also for all your comments on all our other shows. And I need to remind you that you are loved, you matter, and you're not alone. I know that lots of other shows have requests for music. It's never occurred to me to have any requests for music during my shows. But if you would like, a specific song to be played for you, please let us know and we'll stick it in here. All right. So again, you're loved, you matter, and you're not alone. And I look forward to seeing you all next week. Thanks.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.